EGN 125 Ethics and Laws in Nursing, Medical Negligence, Part 3. The fourth element of negligence that needs to be proved by the plaintiff is the plaintiff was harmed. That the plaintiff has suffered injury or loss which a reasonable person in the circumstances could have been expected to foresee. The plaintiff was harmed. Only the medical problems will flow from the negligence will lead to compensation. Other subsequent medical problems which cannot be shown to flow from negligence do not attract compensation. The plaintiff or decedent in wrongful death cases. Decedent is a dead person. Must have been harmed or injured, whether physically, mentally, or economically. If there are no damages, there is no case and nothing could be claimed. We look at the example. This example is related to the previous case. Do you still remember? The 75-year-old man who fell from his bed because of his dementia and eyesight problem, and he wanted to go to the toilet. Now we look at what happened to him. He suffered multiple bone fractures. He could not walk anymore because the spinal cord also affected, causing him to paralyze for the whole life. Is that his fault? Do you think that the patient is able to think well before he made the decision to go down from the bed? And do you think he will be able to estimate the height of the bed because he cannot see very well? The answer is no. And if the patient or his family want to claim for negligence, yes, they may have a case. But don't worry, this is just a story that I created. And this is one of the examples that can generate for a negligence claim. Example number 2. Again, please recall to the example that I have given you before. The obese woman who laid down supine for 7 hours and developed skin redness at her back. So this is the redness. The next day, the skin broke and exposing the epidermis. The worst thing happened. The nurse did not realize the skin changes. Few days later, the wound became sore. The pus started to accumulate and the wound extended more. Have you seen any bad sore before? Then you could imagine how bad it is and how painful the patient feels. The patient needs to stay longer in the hospital. Do you think the patient and her family members will be happy with that? If they realize about the negligence, then they have a case to be claimed. Again, this is just a story that I created for you to imagine how negligence could occur. Before we end this lecture, I would like to show you a few studies that related to medical negligence. Let's have a look at the first study. Ophthalmology medical negligence cases decided by NCDRC, a retrospective study. In the present scenario, medical negligence has become a serious issue in India, and many times it has led to litigations in consumer courts or in civil or criminal court. The National Consumer Dispute Redressal Commission decided 942 cases of alleged medical negligence cases of all specialties from year 2002 to February 2018. Out of these 942 judgments, 30 judgments of alleged medical negligence cases related to ophthalmology specialty from year 2002 to February 2018 were collected for the study. Out of 30 cases, in 22 cases, medical negligence was proved, meaning that the plaintiff has won the case. Majority of cases were diagnosed with suffering from cataract followed by glaucoma. In 16 cases, information regarding medical negligence at stage of patient was not available, while in 11 cases, deficiency of service was present at post-operative stage. Research number 2. Gosipiboma, a medical negligence. Gosipiboma is a term used to denote a mass of cotton material, usually gauze, sponges, and towels, inadvertently left in the body cavity at the end of a surgical operation. A retrospective study done in Surgical and Obstetric and Gynecology Department in Peshawar from January 1st, 2013 to June 30th, 2016 found a total number of 34 patients were managed during study period, in which 11 were male and 23 were female. 13 patients were presented with wound infection, and 8 were presented with intestinal obstruction, abdominal mass, and enterocutaneous fistula, respectively. Research number 3 is closely related to you as a nursing student. Nursing student medication errors and their opinions on the reason of errors, a cross-sectional survey. The objective of this study is to determine number and type of medication administration errors made by nursing students. We will concentrate on this objective only. Method. The cross-sectional study was conducted at 2 schools of nursing, comprised students having worked in hospital setting for a minimum of 1 semester, and who had been involved in administering medication. What is the result? Of the 324 subjects in the study, 124, which is 38.3%, had made an error in clinical field application. 38% is quite high, because as a student, you shouldn't make any medication error because you have taught the class on how to give or administer medication properly. Overall, 402 medication administration errors has been reported, in which 155 were detected and corrected by academic nurses. Because being detected, so lucky. The most common error reported was deviation from aseptic technique. Most common emotion resulting from errors were fear and anxiety. Most common cause was performance deficit, and the most common contributing factors was workload declared by 179. The conclusion of this study says that the error rate among nursing students was high, whereas reporting of errors was low. That's all for my presentation on this topic. Thank you for your attention. Remember, do practice based on what you have learned according to the standard of care to prevent the act of negligence. Don't forget that a student also don't forget that as a student, you also have a risk to do the negligence action if you do not follow the standard of care properly. With that, thank you very much. These are my references. Thank you.